Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Mangled extremity score, severe score. In short, it is known as the MESS, MESS. So there are various gradings based on certain groups. So first group we are going to look at is the skeletal. So there is skeletal as well as a soft tissue. Soft tissue group. So there is a skeletal as well as a soft tissue group. So in this there is again divided into 4 segments. So the first segment stands for the low energy. So the first segment is nothing but it is of low energy. And what are the injuries associated? So injuries it includes the stab wounds. It includes a simple closed stab wounds, a simple closed fractures, as well as small caliber gunshot wounds and the small caliber gunshot wounds. So all this it gets a point of 1. Then moving on, what about the type 2? So under the type 2, it means it is medium energy. It is medium energy. So medium energy, what is the injuries? Injuries is there is open as well as multiple. There is open as well as multiple level of fractures. And there are certain dissociations. So there are dissociations. There is also the moderate crush injuries. Crush injuries. So what are the points here? The point is it gets a point of 2. Next is we move on to the third variety, that is high energy. So in terms of high energy, it is a shotgun blast. It is a shotgun blast, and this refers to a close range. So shotgun blast is nothing but a close range. And what does it involve? It involves high velocity of wounds. It involves high velocity of the wounds. So the point it deserves, the point it gets is 3. Lastly, the grade 4. So as the scores increase and the levels increase, the damage is severe. So 4 means it is massive crush. So massive crush, what is the injury associated? It is the logging. So there is logging, there is railroad, as well as the oil rig accidents. So this is 4 points. Now we move on to the next group, that is a group of shock. So under the shock, there is the first group, it is the normotensor and the hemodynamics. There is normotensor as well as the hemodynamics. So under this, the blood group, it is stable in field and in operation room. So the blood pressure, it is stable in the field and the operation room. The field as well as the operation theatre or the operation room. So here the score is 0. Now the second score, the second variety, it is transiently and hypotensive. So here the BP, that is the blood pressure, it remains unstable in field. So it remains unstable, but the responsive to the intravenous fluids. But it is responsive to the intravenous fluids. So the score it deserves, the score it gets is 1. Next is the shock group 3. So here it is prolonged as well as it is hypotensive. So there is a systolic BP less than 90. So systolic BP is less than 90 Hg, and this is in field and responsive fluid. This is in field and responsive fluid, and this is only in the OT, that is the operation theatre or the operation room. So this scoring is 2. Then we have the ischemic group. So in terms of the ischemic group, it is divided into none, mild, moderate and advanced. So one means none. So here there is a pulsating limb without signs of ischemia. There is a pulsating limb, and this will be without signs of ischemia. This is without signs of the ischemia. So here the point is 1. Then comes mild. So mild is nothing but it is diminished pulses without the signs of ischemia. So it is diminished pulses. This is without the signs of ischemia. So this is a score of 2. Then we move on to moderate. Moderate means there is no pulse. Moderate means there is no pulse by Doppler. And there is a sluggish capillary refill. So the sluggish capillary refill, and there is also the paresthesia. There is paresthesia as well as the diminished motor activity. So here the grading is 3. Then lastly we move on to the advanced variety. So 4 is for the advanced, and the pulses, so it is pulseless, it is cool, paralyzed and numb without the capillary refill. So it is also numb, and this is without the capillary refill. Now other thing to note in the ischemic group is that so in this group there is if the ischemia time is greater than 6 hours. So if the ischemic time is greater than 6 hours, the ischemia score is doubled. So then you do the ischemia score. Then the ischemia score is into 2, that is, it is doubled. Now let's look at the age group. So in terms of the age group, there is 1. 1 means less than 30 years. So if it is less than 30 years, it is a score of 0. Next up is 30 to 50 years, it is a score of 1. And greater than 50 years, it is going to be 2. So now when you are looking at the MES score, if the MES score is less than 7, so the MES score is less than 7, it is usually associated with the salvageable limb. So it is associated with the salvageable limb. And if the MES score is, this is if it is less than 7. If it is greater than or equal to 7, it is usually associated, and this is with the requirement of the limb amputation. Limb amputation. To learn and grow daily like this, please do subscribe.